My name is Joy. I'm a practice nurse. I studied in South Africa and completed in 1984. I've been a practice nurse since 2004, working in Hammersmith and Fulham, stationed in Sterndale Surgery. As a practice nurse, it is complex issues which happens on daily basis, but the main thing is prevention and promoting of health. So I do diabetic clinics, asthma clinics, cervical screening, prevention of lots of diseases like flu, vaccinations, COVID, and also educating people to prevent complications of their diseases. Also ear syringing, baby immunization, tribal health, list is unending. A typical day is really different on each daily basis. Mostly you'll find that you don't know what you're coming to face on each day, but looking at the list, you just have to organize your workload and then you plan. So you don't know what is coming on the door. So much difference happening on lives, but you have to be focused and be ready. My role is really exciting because when I work here autonomously, I can decide on how to approach my own patients because everyone is unique. So whoever comes in, you don't have to treat them the same. Some needs more time, some needs just enough time. They just want in and out and then they understand. But really every day it's different. You just have to be patient and be caring. The most challenging part of my role is you don't know what the patient is expecting from you, and when you explain a new diagnosis, they get a shock, and then you have to be calm and be empathetic and sympathetic and explain, communicate well so that the person understands and don't take like it's a blame or it's a death sentence. I deal with diabetic problems, which also when they come in here, they don't know where to start most of the time. It's hard to accept the diagnosis, but you just have to be focused on how you tackle them and how you do the follow-ups and how you communicate with them, as everyone is different. I can make my own decisions when I see that this is really crucial, like I do a wound care and it's not healing, then I can transfer. Before I do that, I try harder to tackle that wound to be healed, but then I refer to specialists. You can be team. Obviously, you have to work with a team, but mostly you work independently, alone in here. But you have to involve the reception, the doctors, the pharmacist, and everyone it's in one place. You don't have to work in isolation. What excites me is when I see the improvement when a person comes in the first time being distressed because of the diagnosis, and when they come in, they follow up, they become so happy because you have given them so much information and you have helped them, and it's working like you are a team between the two of you, and they are accepting what you have advised them. The important skill is the communication. It's the key, because you have to be able to transfer the knowledge to the person, and you also have to make sure that the person you're talking to understand, and you have to be good in organizing your workload. So you have to be really skilled and be careful that you need to arrange everything in a daily basis depending on the clinic. My uncle was an obstetrician, so I used to follow him when he was delivering at his clinic. He was delivering mothers. And after the baby comes in, and the joy of the woman who has just delivered makes the whole atmosphere so joyous. So I will see my uncle as an obstetrician being happy, and the mother being happy, and the baby happy. So I really said I wanted to be like that. I started as a registered nurse who was working in different aspects in the hospital. But after some time, I've been through the theaters, accident and emergencies. I found this post of being a practice nurse, and then I pursued my way in, and there I am, never turning back. Most people get into this field because of looking at the role of the way we behave as professionals, and then they want to become one of them because they also think they can do the caring because you are caring, and so it's a sort of a infectious. But if you have patience, you talk to them, they become one of them. I have seen a 2-year-old boy coming in with the mother. The mother was screaming on the door, and the baby was gray and floppy. And when I ran into them, I just grabbed the baby and called help, and we started resuscitating the baby. And the baby was fine before the ambulance came. That was really my joy. In primary care, it's different from the secondary care because here you prevent and promote health to prevent them from going to the secondary care. The main thing here, you are getting a lot of support from the team here and also from the nursing forum. There's a network of nurses around Hammersmith and Fulham, so you're not lost in one thing. I wish I had known that the telephone calls will be a lot. Now I'm using telephone calls like a teenager, advising, ordering through the phone, communicating with other team members, following up, booking in. So there's so much of telephone which I didn't think I would be doing that.